So that's what it is. Subluxation alters or interferes communication between the brain, the nervous system, and all the pieces and parts of the body, including the muscles that would formulate and create speech. So if there is neurological communication interference, there will be actual communication interference for your child. Welcome to the Experience Miracles podcast, where we help parents find hope, answers, and drug-free help to overcome your child's chronic health challenges. I'm your host, Dr. Tony Ebel, and I'll be sharing my experiences as both a dad and a doctor on every episode. I can take the latest science and neurology of healing and break it down in the most simple and relatable way possible. We'll take on the toughest topics and answer your biggest questions through interviews with other amazing parents and leading experts, leaving you with practical action steps that you can take to help your child heal and thrive. It's time to expect and experience miracles. Let's get started. All right, parents, welcome back to another episode of the Experience Miracles podcast. We are diving deep into speech delays here today, and we're going to go through the whole spectrum, or all the different levels of speech delays, if you will. So if your child is struggling with some mild to moderate speech delays, and in terms of fluidity and efficiency and formation of words and sentences and so forth, and you're in speech therapy and you're working on that, this episode is for you. And it's also for you if your child is at the end of that, or I don't know how to best say that, because truth is, I don't really like to talk about mild, moderate, severe, because when it's your kiddo struggling with anything, there is no little bit. There is no mild. It's our child. It's our kiddo. And so any struggle, it's big to us, right? It's a really, really big deal. But obviously, if we have a child going through level 3 autism, which generally comes with nonverbal, so maybe a few words, but really mostly nonverbal, we're talking about that on this deep dive episode about speech delays as well. And so we're going to, like we do on all of these solo episodes, we're going to dive deep into not just what the symptoms and the struggles are. You know those, you live those. So I'm not really going to spend a lot of time. We usually do go through a quick outline of what these struggles actually are, because sometimes for parents, this is brand new and they're just starting to get awareness that their child struggles with these things like sensory speech and so forth. But we're not going to spend a lot of time on the symptoms or the stats, because that's what the conventional system and the internet will tell you. What they won't tell you out there in the traditional pediatrician's office. And honestly, this is really a great episode to share with your speech therapist, your occupational therapist, and your therapy team, because I've been able to teach this stuff. We call it the perfect storm in kind of a bigger picture, the science behind all these neurological challenges in kiddos. But I've done a lot of workshops with other professionals, specifically speech therapists, OTs, and pediatric PTs. And I've taught them what we're going to teach here on this episode, which is the real deepest layer root cause, step by step, almost kind of the mechanics of speech. And very few people out there take it this deep. They go beyond the muscles, because that's what I want to say right out of the gates with this speech issues. Just like our last episode, right now we're on a whole series of talking about developmental challenges. And a lot of that conversation centers around the motor system, which is the muscular system. And whether we're talking about weak core, low tone, or here today, speech delays, a lot of times we think it's just a structural or a muscular motor problem, either gross motor, that's the big muscles, or fine motor, which are the little ones that are involved here within speech. But that's not all the way true. There's a deeper layer going on. There's a deeper root cause and dysfunction within the nervous system. And I'm going to teach you that in my way. We're going to get all sciencey, we're going to get all nerdy, and then we're going to keep it really, really simple as well. So you don't have to be a nerd like a neurologically-focused pediatric chiropractor or a speech therapist. I do find that my therapy homies out there, they love the deeper we go, the more sciencey we go. They love that too. And who am I kidding? So many of you parents have reached out and said that you are loving these deep dive, very sciencey episodes as well. And so before I actually get into the real thick of this, I just want to take a minute and do something that is very important to me and say thank you. I think by the time this one comes out, we might be in the 30s. This might be episode around 30, 31. I don't know. Like everywhere in my life, I have an incredible team that takes care of everything. I just get to do the stuff that God really put inside me that I love to do and helps kids and helps families. And then I have this incredible team all around me, Dr. Morgan and Chris, and just especially with the podcast, those two are just world changers on our team. But all of you are what this is for. You're why we're doing this. And I need to say thank you to those moms and those parents out there who are listening to every single episode and then reaching out to us and not only leaving a review. This summer, we did a really fun review challenge, but you're sending us messages either on the PX Docs Instagram or Facebook page. And many of you have reached out to me personally as well. And I just want you to know, I read every one of them. I read every word and I feel every word. This was, I won't take up too much of our time here with this, but I just have to say thank you to each of you. This is 1000% such a just pure, just relentless, obsessive mission for us. It really is. You can ask the team, not that you would maybe be meeting them in person, but I was resistant to this. I wanted to create this platform. I wanted to make our website and write articles. I wanted to use Instagram and Facebook and use social media for good and try and outpoint the bad that sometimes is out there. And then I love podcasts. I live in the middle of nowhere. I live on a farm, and I'm always listening to podcasts and making my life better as a result for the things that I'm passionate about and the things I need help with. And so I wanted to do a podcast. I just didn't want to put my name on it, if I'm being honest. So just a little personal story and a thank you to kick us off with this one before we get all sciencey and all into the mechanics of speech delays and how you can help your family get to the other side. But just the way I'm wired, the farm kid in me, if I don't really express my gratitude to each of you, who many of you are listening to every single episode, you're posting it in all the different Facebook groups, you're posting it on your Instagram stories, you're texting it out on all those mom chats, which I know you've got, and I reference those all the time. You're even sharing it, with the other moms who use Androids and Samsungs and ruin these group chats for the rest of us. And you care about them so much that you're sending it to them too, which is fantastic. And I just want to say thank you. I just want you to know that you're the hero in the story. I just want you to know that your kiddo is the hero in the story. I'm just a guide. I'm just an information gatherer and a connection maker. So I'm here to get you the information. I want to empower the heck out of you. Just refill and refuel your hope, because as parents, this gets real hard. Parenting, when it's going smooth, isn't easy. And when our kids are sick, it gets infinitely, exponentially harder. And then the more they struggle with, the more that goes on. So I just want to always, with every episode, just reboot your hope and reinstill your confidence that God gave you your child and you're in that storm because he knows you're the one that's going to guide your child through it. You're going to find the podcast. You're going to find the Instagram page. You're going to find the doctor that you've been looking for all along. And that's what this podcast is. It's hope, then the answers and the explanations and the science, and then that leads to the action steps, which, remember, every single episode, no matter how many random stories, farmer stories, dad jokes, tangents, and sometimes I call them rangents, which is like a rant and a tangent together. And I shouldn't say these words out loud on a podcast, but, as I make them up on the fly. But no matter how many of those, plus how many times we get into neurology and science and how long it takes me to get into those things, at the end of every episode is the action. And I'll never leave you without that. Even whether we're doing a solo like this or an interview, we'll always move forward. A lot of times my job is actually taking you guys backwards first and going further into your child's case history to talk about the role that stressful pregnancies and birth interventions and colic and chronic ear infections and antibiotics and skipped crawling. We're going to talk a lot about missed milestones with this one that lead up to speech delays. And so often those things have been dismissed. They have been normalized. You have been told by the doctor you're supposed to trust, who's supposed to know all this stuff. You've been told, don't worry. They dismiss it. They dismiss you. And they say, don't worry, they'll grow out of it. And you've known all along. So our job in this way often is my least favorite part of my job, where I go backwards and I teach you the truth that they didn't and teach you the science that they don't know. That's why they didn't teach it to you. So I want you to really hear me and really feel me on this, moms. The reason we go backwards is so you can have greater clarity, confidence, and I would call it effectiveness and results going forward. We actually have to go back into the triggers. We have to go back into the root cause and really break it down so that you know what is going on, what's causing your child's challenges, and for a lot of families, what's missing yet in terms of the action plan and the care team to get them better. So long-winded thank you that also includes a review, a kind of just an explanation of the whole mission, vision, and purpose of this podcast. And just thank you for tuning in. Thank you for sharing it. Let's get into it. The speech delays deep dive episode. So like all developmental challenges in kiddos, seeing your child struggle with speech, again, like I kicked off at the very beginning, whether it's quote unquote mild, moderate, or significant and severe, it's really stressful, really pulls on your heartstrings as a parent. And it's a son of a gun too, because when your little one is struggling with speech delays, you're with them 24/7, 365. So the way God made everybody's brains is the more you're around something, this is actually kind of teaching some of the components of speech, the more times you hear it, which later on we'll talk about the perception or the auditory input component of speech, which is the first element, the first part of the process. The 3-part process will teach you simplifying speech. The more you're around it and you hear your child, you can make sense of it, right? But what about when they go off to preschool? What about when they go to play with other kiddos? What about when they get into, the later years? If these speech delays, even the quote unquote mild to moderate ones, if they stick around, that can cause your child some social, emotional challenges later on. And we know that. So our concern, our worry about this starts to ratchet up. It can be very frustrating. Then for a lot of parents today, there's another layer of frustration with speech delays. And that is this. You're going after it. You're doing things that are supposed to help. And I always use the word fix. That's my farmer word. I probably shouldn't use it because a lot of times when I say fix, I think people think, oh, there's a cure. If you really address the root cause and you really look at what you want for your child, you're not actually looking for a cure. You find the root cause. You get into the components that are the malfunction, the dysfunction within the nerves, the muscles, and the system for this conversation. You get those fixed. You get those taken care of. And the body cures itself. The body takes care of itself. And so cure is just one of those words we tend to very intentionally, strategically stay away from, because when you address the dysfunction and the dysregulation within the body that's causing the condition, today we're talking about speech delays, the cure is in there. The healing is in there. Your child has the capacity to do this. But the frustration mounts if you're doing weeks, months. Sometimes families come in and they've been doing years of therapy and speech therapy, and their kiddo's just plateaued. Their kiddo is just stuck, or they're making very slow, gradual, smaller or less than the parents would like progress. And then in this conversation, I told you we'd have it, and we will. What about the kiddos who regressed, went backwards? What about the kiddos who had some words, had some speech and communication coming online, and then at 18 months, 24 months, or whatever kind of junction of development it was, where I'll teach you the nervous system just got so stressed, so overwhelmed, it shuts down. We're going to talk about the neurological causative components of speech delays for mild, for moderate, and for nonverbal. So all along that arc as parents, we are constantly, just like any other condition, we're asking, why is this happening? What's causing it? And what can I do about it that addresses that root cause? So first plan with this episode, we're going to break down exactly what speech delays are. We're going to talk about the milestones. We're going to talk about kind of the calendar, the timeline. But most importantly, see what really throws a lot of professionals, but then parents, because if professionals are using the calendar, meaning your child is supposed to do X and then Y, or let me go A and then B and then C at this certain age, it's kind of like the height and the weight thing. The developmental milestones, when we do them by age, that's a recipe for disaster. And this is one of the things I want to teach you within this episode, is just a different viewpoint and perspective altogether on developmental milestones. The calendar, your child's age of these things, it's relative. We definitely know that if these certain things are not coming online and coming into play for your child within a certain time window or range, okay, that's going to raise a little bit of a red flag, and we want to look deeper. We want to get your child the interventions and the help to get them through it. But I want you to know this. What is way more important than the calendar and their age is something called the sequence. You will hear us talk about the neurological hierarchy or sequence, or because I grew up playing baseball, I often use the metaphor of batting order. You'll hear us talk about that over and over again on this podcast and our platform, because everybody else in the pediatrician and traditional therapy world, they're obsessed with saying by 12 months, your child's supposed to do boom. By 18 months, they're supposed to do this. What if they were born 8 weeks early? What if they were born 7 pounds versus 10 pounds? These things matter significantly. The way neurodevelopment works, it is so intricate, it is so advanced, and it's just, the best word is intricate and detailed, that these details matter. If a child was born early, if a child had a stressful, which you're going to see, that's the number one most overlooked trigger of speech delays, is birth interventions. So C-section, emergency C-section, forceps, vacuum, cord wrapped, those are all neuromechanical, neuromuscular, physical injuries. Those interventions become injuries to the nerves and the muscles that control speech. And I'm going to get into that. I'm a little cart before the horse. But if your child had that, then they're going to be the same age, but developmentally, they're going to be delayed. And so what we're really always teaching parents is the most important thing to look out for with your child's development is the sequence or the order with which they develop. That matters more than just the age and the calendar, because there's so many factors for your child. So what we do is, you won't see these charts on our walls in our office in PX Talks. We don't say your child is supposed to do this by then and supposed to do this. We don't treat every child the same. We don't cookie cutter our approach like medicine does. Your child gets a personalized, individualized assessment and understanding of where they are. Okay, so that may have felt like a little bit of a right turn, but it's essential to look at development differently than the standard pediatrician, because if they understood that the sequence and all these things that go through in your child's early case history, if there was a stressful pregnancy, if there was birth intervention, honestly, even if they're just a bigger baby. So we had 2 of our kiddos who were, born just a little bit early, especially Oliver. He was a little extra early, and so they were smaller. And then we had 2 of our kiddos who went way past, the 2 little girls went way past 40 weeks, so they were bigger. So their development, literally, because it's a neuromuscular thing, so the more muscles, the more structure you've got to coordinate and get online. That's a big deal. And right now, if you're going through this and kind of heading on and going, I kind of always thought that, like, is this stinking calendar? Because they stress you out about that. They use that to scare the heck out of you, like, oh, they should be doing this. Man, the last thing us parents need is, more shoulds in our life with that. Okay, so we're going to get into that, the sequence of speech delays and what they really are. And then we're going to break it down in this way. We're going to really get into the mechanics. I've referenced that a few times. We're going to break speech down advanced but simple. We're going to put it into a 3-step process: input, integration, coordination, and then output. Okay. And I'll give you the details on those here in just a second. Second, we'll get even deeper and we'll say, okay, now that we know the mechanics, now that we know how speech is supposed to work in this 3-step process, now we can identify where the interference, where the dysfunction may be really first, foundationally, real root cause set up shop that is causing the muscles, the vocal cords, and so forth to be dysfunctional and not as smooth and effective as they should be. So we'll get into the real root cause. Third, we'll talk about it once again in the scope of the overall developmental process, and we'll look both backwards to say your child's speech delays may be because other earlier, so in the sequence again, if 1 or 2 things ahead of the speech formation and development as God designed it and the nervous system operates it, if something upstream is off track and still dysfunctional, still dysregulated, still delayed itself, well, then speech isn't going to turn on and come online. So oftentimes and I'm going to use my word again, my farmer word, oftentimes to fix and help with speech delays, we actually have to swim upstream and get into some of these earlier challenges that are still there, get those taken care of, get those kind of out of the way developmentally, if you will, so that the brain and nervous system, as it does sequentially, can get to speech and turn those on. Fourth, we'll connect the dots to speech delays and autism and nonverbal. And again, like we talked about, fifth, I will make sure we get into the solutions and get into the strategies, the drug-free ones that may be missing right now from your family's plan and from your care team that can really help improve these challenges within the nervous system, the neuromuscular system, and all the science we're going to talk about here today. So here's how speech works. It is a sequential, there's that word again, 3-step process. So of course, speech involves the lungs and the vocal cords and the muscles, but first, before the motor muscles of speech, the output muscles that actually form and create words and sentences in speech can do their job, there is a sensory input. There is a sensory receptive aspect of speech where the auditory and cognitive signals must first be received by the brain. So I want you to put one word on step 1 of speech, input. This is a neurosensory function. The way our nervous system works is there is an input side, there is a receptive, perceptive. The nerd word is what's called afferent. So coming in signals, that part of speech is essential first. You have to have clean, clear information coming into the brain and the nervous system, and it must get in cleanly, clearly. I'm going to use the words efficiently and effectively. So if there's any interference on the auditory, receptive input, sensory input side of this, well, then there's going to be problems with number 2 and number 3 in terms of this sequence if number 1 is thrown offline or dysfunctional first. Second, now once that brain and nervous system receives that auditory sensory input, it's got to integrate it and coordinate it. So there's decision making within the brain and the nervous system second. And then third, now the brain sends signals to the muscles through the through the central nervous system to the nerves and the muscles that actually form, execute, and create speech. So if we go back through that one more time and we just one word each of them, you have number 1, input, number 2, integration, and number 3, output or formation. Okay? Now, next section, we're going to talk about the role of subluxation, vagus nerve dysfunction, or just nervous system dysfunction, dysregulation, and what's called dysautonomia. Now, these are terms I use in pretty much every single podcast episode. They're new terms for most families and most professionals because most people don't like gut issues. They look at it as toxins and inflammation and those sort of things. Now we're in motor delays. Like we're doing this whole run of episodes about low tone, speech challenges, developmental delays, and we look at it from a motor standpoint, which is why we go to movement-based therapies, PT, OT, and speech therapy as first. So the pediatrician, even if they recognize it, spot it as an issue, they then send down those roads. Now, those specialists, those rock stars are looking at this as a muscle problem, a motor problem. But the reason that those 4 or 5 terms, which are pretty synonymous and interchangeable with each other, subluxation, vagus nerve dysfunction, nervous system dysfunction, dysregulation, and dysautonomia, I want you to think of those as kind of all one thing, just interference and dysfunction within the nervous system. Now, the function of the nervous system is to perceive, coordinate, and then express. So the nervous system runs all 3 layers of speech. The nervous system, and especially the neurosensory system, it's in charge of input. Then, if you will, kind of under the hood, inside the brain, within all the advanced, intricate, incredible parts of the brain, that's where step 2 happens. So that's the integration, the coordination, and the organization of speech, step 2. And then it sends those signals out to the other side of the nervous system, because the nervous system has input, the nervous system has integration and coordination, and then the nervous system controls decision-making. The nervous system controls output and expression. And so what happens is there's this thing called subluxation, which interferes with the messages coming in. See, subluxation can set up shop. So subluxation is misalignment, reduced range of motion. It is altered neuromuscular function within the neurospinal system and the brainstem. So subluxation can set up shop anywhere within the body. There can be joints and these things that are misaligned, reduced range of motion, and anytime you get them out of alignment and they don't move through their fluid, efficient range of motion. So this is a movement-based issue. Anytime you have subluxation in the, we'll kind of, just for now to split the hairs, say in the biomechanical way, you automatically are going to get in the nervous system's way because everything is intricately controlled and coordinated by the autonomic and central nervous system. So there's the sensory side, input. There's the integration and decision-making side. That is the brain-based side of it. And then there's the output, the central nervous system. Where subluxation sets up shop is often in the deeper layers of it, which is why other professionals don't quite know to find it because they don't know quite about it, so they don't know to look for it. And if you don't know to look for something, you're certainly not going to find it. But subluxation can actually set up shop in between each of those functions as well. And so what happens is if you have subluxation, so here's putting the whole thing together. If you have subluxation, neurological interference and dysfunction, if you have it on the auditory, perceptive, receptive first step of speech, you're not going to have speech at all on the output. So what we find, and this is how we put it all together, and it's a little hard to do this on a podcast. Usually I can draw this out on a whiteboard and kind of show these three different functions, sequences of speech, and then we can put the three different severity levels, but they go together. If a child's subluxation is severe enough, and I like to say deep within the system enough to interfere with step one, flat out auditory receptive program or input of speech, then they're not going to have it at all. If you can't get to step one, you can't get to step two, and you can't get to step three. Now, the more moderate to mild cases of speech delays, that is a clue that subluxation and this neuromuscular nervous system interference has set up shop at step 2 or step 3. And here's how you can, so this one's different. Instead of just listing the symptoms, I actually wanted to look into the different components or the different severities and styles of speech delays, and at the same time map it out for you where on the neuromuscular process, 3-step sequence of speech, your challenge's dysfunction likely is. Because if your child's speech delay is more in what we would call the efficiency and the fluidity. So if you're communicating with your child or someone else is, and you can tell it just takes them a little bit longer for their brain and nervous system to process it, make sense of it, and then execute it. So let's say your child has their words. Let's say your child has the expression of speech, but their speech delay is more like a time delay. So in conversation, it just takes them a little bit longer to take it in, make sense of it, decide what they want to say in response, and then do so. If it's just inefficient is the word we often use for that, that's a sign of subluxation on step 2. Now, the third category is the third step. Let's say that you can tell your child's auditory perception. So even a lot of children with autism, parents can tell that it's actually step 2 as well, because the kid knows, you know, your child knows. They're picking up what you're putting down metaphorically. They are perceptive. You can tell that their auditory processing sensory input function is there, but they just can't relay it and communicate back out. Well, what if it's a little bit more mild than that? So if a child has subluxation and neurological interference between step 2 and step 3, now it's just not fluid. It's just not clear. So that is the final stages of the nervous system coordinating and orchestrating the exact function of these tiny, intricate, important muscles that are the vocal cords and so forth that create speech. So that's why for a lot of speech delays, especially if it's more the mild to moderate case, they look at things like tongue and jaw function. They look at things like tongue and oral ties. They look at it from a muscular output problem, but often the reason the muscles are outputting or expressing speech in a slightly delayed, inefficient, disorganized, not super clear way is because the interference is actually one level deeper within the nervous system within step 2 as it relates to step 3. So that, especially speaking of speech delays, and sensory, auditory perception, especially that last 10 minutes is just me talking about this stuff on this podcast without a graph, without a chart. Let me just recap it one more time. Speech is a sequential 3-step process. First is sensory, auditory input. Can your child properly, cleanly, completely, efficiently receive auditory, speech and communication input from their environment into their brain? Step 1 is input. Step 2 is integration, coordination, decision-making. Can the brain make sense of it? Not just can the brain make sense of it, can it do so in a very fast, very efficient, and organized manner? If it can't, your child may have speech, but the processing, the receiving, and then putting back out, there's a time delay. Number 3 is output and expression. And what we think of most of the time is it must be a number 3 problem, but number 3 is dependent upon number 1 and number 2 effectively functioning and working within the brain and the nervous system. So often parents of speech challenged kiddos are told it's dysfunctional muscles and tissues, and we just need to work on that. But again, one more time, really the root cause of speech delays almost every single time is further upstream, and the dysfunction is either on the sensory input, step 1, or the integration coordination, step 2, or both components of the brain and nervous system. So second, we've already introduced these terms in a major way, but the role that subluxation, nervous system dysfunction, and especially something called the vagus nerve. I really want to talk for a few minutes about the role of the vagus nerve. And maybe you've heard about this, and speech therapists, if you're listening in, you definitely know about this, because the vagus nerve is primarily sensory. And the vagus nerve is a very important, the most important, especially when it comes to speech and autism and developmental delays. The vagus nerve is a sensory nerve. 85% of the nerve fibers from the vagus nerve are sensory. So it really plays a huge role in the sensory and receptive component of speech. And it plays a huge role in the coordination, integration, and just efficiency of speech as well. But there actually is, if the vagus nerve is 85% sensory, that means 15% of its nerve fibers are motor, their output. And actually, if you break down those components, this is the nerdiest part of the podcast, I promise. And you're like, wait a minute, you were just super, super nerdy for a little bit. You got more nerdy? A little bit more nerdy. So the vagus nerve, if we break down, I've studied this sucker more than probably anybody else out there. You break down that extra or the other 15% of the vagus nerve that is not sensory, that is motor and output. A large percentage of that 15% is specifically related to speech formation and execution. So here's all you need to know. I went real deep in that last section, so I'm going to go real light to just kind of put the icing on the cake with this one. When there is vagus nerve dysfunction, it can mess with all 3 components of speech. When the vagus nerve is not functioning in its fullest, it can throw off step 1, sensory input. It can throw off step 2, integration and processing of speech. And it can even throw off and be involved in step 3, which is the actual motor execution and formation of speech. So subluxation and vagus nerve dysfunction in the brainstem area are a big deal. So if you've listened to any of the other podcasts where we talk about pretty much any other condition, but especially neurodevelopmental conditions, you probably know where I'm going next. What would cause subluxation, vagus nerve dysfunction, nervous system dysregulation in the first place? Birth trauma. Birth interventions are the number one. So if we just, let's for a minute, let's go ahead and leave speech delays, including nonverbal. Let's leave them in the neuromuscular. This is hard for me to say because nothing is actually the way God designed the way God designed us. Our body is so brilliant. We can study them in different chapters. Like if you go in through school like we did, and you go through an anatomy textbook in all your classes, everything is compartmentalized. We're going to learn about the muscular system during this class. We're going to learn about the circulatory system in this class. We're going to learn about the digestive system in this class. The way function, day to day, moment to moment, second to second, happens within your child's body. Nothing is separated. Everything is connected. And do you know what connects it? The nervous system. If there is one foundational scientific real life principle I can teach you that the rest of the world just doesn't, in healthcare, doesn't seem to operate within, is the most basic important component of health, which is everything is connected. You can't treat systems separately. Guess what medicine has done? Separated. You've got a specialist for this and a specialist for this. Even most therapies are separated. Neurologically-focused chiropractic isn't. When people go, you're over the top. You're full of crap. This is all hyperbole. How can one thing, chiropractic, how can one thing help all these things? You're saying you can help out with this and that and everything else? Yes, because we don't treat that. We don't cure that, anything, not even back pain, nothing. We take care of the nervous system, and the nervous system controls and coordinates everything. So in this conversation, anything that would throw the air traffic control of the central and autonomic nervous system, and especially the vagus nerve, offline and create interference or dysfunction within it would be the biggest deal out there. And medicine still blames genetics or says, we don't know what causes this stuff, conventional medicine. The rest of the natural holistic world is going to look at tongue ties and oral ties and food intolerances and microbiome. And there is connections to those things, to speech, to the vagus nerve, to the conversation we're having today. Nothing connects more clearly to this physical. So if I'm forced to put the speech delays into a box and we say, okay, it's a motor issue, we could also call it then a physical, structural. And you can't unattach the nervous system from it. So let me just put that back in here now. The neurobiomechanical, the neurostructural, the neuromuscular dysfunction and problem that is speech, we should be looking for something that physically, structurally, neuromuscularly injures that system. That would be forceps. That would be vacuum. That would be C-section, especially if it's a forceful C-section. That would be cord wrapped. That would be breech position. That would be any sort of physical intervention to the baby's neck and brainstem. Look at where speech comes from: the mouth, the jaw, the vocal cords, the nerves that control and coordinate the perception, the integration, and the execution of speech. All exist right there. It's actually very point blank. It's like a lot of things I talk about on this podcast since we round third base and close this one down. The answers are right in front of us, but it's all been normalized. Yanking kids out with a big old pliers, plunger, or set of hands. So pliers, that's a farm term, forceps, plunger, vacuum, and then saying, oh, don't worry, they're going to be okay. We know statistically, there's meta-analysis studies that we know more birth interventions, more problems, especially neurosensory, neurodevelopmental delays. And then we also can just look at it simply from a scientific construct and say, if we physically misalign, alter, injure, interfere with those nerves and those functions and those regions and the vagus nerve, well, of course, we're going to have subluxation, neuromuscular dysfunction. We're going to interfere with the signaling and the processing of that three-step coordination of speech. And the brain and the body, including the muscles of speech, there's going to be communication issues. So that's what it is. I want to close it down with that analogy, that metaphor. Subluxation alters or interferes communication between the brain, the nervous system, and all the pieces and parts of the body, including the muscles that would formulate and create speech. So if there is neurological communication interference, there will be actual communication interference for your child. And I just want to put a bow on it one more time. The earlier that occurred, the greater likelihood that child has these challenges, and the greater likelihood that they're a little bit or a lot of bit more severe. And the deeper within the nervous system that subluxation sets up shop. If your child's subluxation is severe or significant enough to interfere with auditory perceptive input, well, then they're going to have much more higher degrees, greater severity. It's hard for me to say bad words. I'm such a glasses half full guy, but they're going to struggle more with speech delays. So vagus nerve dysfunction, vagus nerve injury. By the way, I chose on this episode right here because speech is very much a muscular physical component. It's just not that. It's neurosensory, in coordination underneath of it. But the vagus nerve is also very sensitive to toxins. And the vagus nerve is very sensitive to inflammation. And the vagus nerve and the nervous system as a whole is very sensitive to emotional trauma. So there's other triggers into the perfect storm beyond birth interventions. So if you get done with this episode and you go, okay, all the science between the 3-step process of speech and how neurological, neuromuscular interference can set up shop, if the mechanics of this conversation make sense to you, but then your child did not have any birth interventions, if they had an awesome, if just natural non-intervention birth, now I may have left you going, but wait a minute, my child clearly has subluxation and neurological dysfunction. That's got to be the story going on here with their speech challenges, but I don't have this in the case history. I want you to know that the vagus nerve and the nervous system are sensitive to other types of stressors as well. The biggest clinical correlation and the most overlooked happens right in front of it for about 85 to right in front of us. But again, medicine dismisses it and says it's normal. 85 to 90% of the cases we've seen of speech delays, mild, moderate, severe, including nonverbal autism, it's over 90% of the time we see birth intervention to some degree, form, or fashion. Now, that means 5 to 10% of the time we don't. In those cases, when we dive deep into those case histories, there was usually a significant amount of emotional trauma during the pregnancy or the early childhood development for that family. There was a significant amount of toxins, antibiotics, other medical interventions that get into the body, wreak havoc, create inflammation. That will throw the vagus nerve and all of this offline as well and can trigger this whole perfect storm. And also, it sounds so simple, but a lot of times when a child is going through gross motor development, they just don't do a good job with it. There's a lot of falls. There's a lot of bumps. There's a hit their head on the coffee table. There's a fall off the couch and land on their head. And that can create this subluxation and misalignment within the neck and the nervous system as well. So that's the final talking point with this. Oftentimes, the biggest remaining thing to take care of to get speech, socialization, communication, which is what's called a fine motor or an advanced nervous system development function, oftentimes to get that online and working better, we need to swim upstream and we need to address gross motor delays. So if your child had very obvious gross motor delays, if they had delayed walking, if they had delayed crawling, or especially if they skipped crawling altogether, or even if, hear me on this one, parents, even if still today they can crawl, they can walk, they can run, but they're all discombobulated. They're all incoordinated. The way they handle gravity and move their body, gross motor means all the big muscles and the whole body moving through gravity. So crawling, walking, climbing stairs, running, so playing catch, like these big muscle functions. If that is happening, but not smoothly, not efficiently, not in a very organized way, then that means there is still gross motor delays, or what we call gross motor dysfunction and interference. And the way God designed brain and nervous system development is very much project management. And the brain will not be able to get to speech, communication, socialization, cognition, emotional and behavioral regulation if it's still stuck on an earlier stage of development and trying to fix that. Okay. So this is very sequential. And that's it's kind of another point, but it's a reminder of the point we've been making all along. Speech and these brain-based functions, they're downstream. They're one of the last things to turn on and come online for your child's brain and nervous system. So if there's triggers, perfect storm upstream, that threw all that off, or if there is still challenges, if your child is still dealing with some gross motor challenges, and often these more minute or kind of harder to spot inefficiencies, we kind of call these kiddos the drunken bull, discombobulated, falling all over the place, that actually will leave in play challenges that could set up a speech delay, because again, the brain is smart. The nervous system and neurodevelopment are very sequential, and it's not going to go into advanced brain-based development and get those jobs started and done until it feels like it's done with gross motor development. So if your child is going through some speech delays, some sensory issues, some behavior and emotional regulation, don't forget to look upstream with your providers, which is where I'm going to next, to look at the gross motor and overall nervous system function as well. So what do you do from here? So every episode is, it's the vast, speaking of 85-90% of it, is the science and the sequencing and the neurology. And awesomely, the call to action, if you will, from this is really point blank. If your child is still subluxated and this conversation gets you to say, that's it, that's got to be it, I need to find out, then that's the action you take. You got to go find out. So this deeper level of root cause neurology and neurological dysfunction, taking a look at it with this perspective and this lens, is something that only neurologically focused chiropractors do. You'll notice that when a PT or an OT or a speech therapist does an evaluation of a child with speech delays, they don't really examine the brainstem, the neck, and the neurospinal system. But that is the foundational, formational hub of all the other motor functions of the body. So if we don't run an exam and evaluation, which are what we call our insight scans, to look for subluxation within the brainstem, within the neck, and within the nervous system first, well, then everything else downstream is secondary or tertiary. So if we're trying to work on a secondary issue instead of a primary, we're never going to get it all the way better and get it to stick. So what I highly encourage you to do is go to the show notes, click the links, read more, go look into some of our articles about speech delays and subluxation and birth trauma. But the moment you know, I got to find out, is my child subluxated? Is this exactly what's going on and why we have these speech challenges? Why we're doing therapy and not quite getting a breakthrough and getting progress? Why are we plateaued? Why are we stuck? Or why did your child regress? Get to a nervous system focused chiropractor, get to a PX doctor. We will always put our directory. We have hundreds, soon thousands of trained, ready nervous system focused pediatric chiropractors all over the world. On our directory, you can literally fill out a form and get connected with them. And here's the 3-step process. So one more set of 3 that we'll leave you with. Number 1, you will find that doctor listens more intently and more actively than any doctor you've ever met. And additionally, as important, they will dive deep into your child's case history. They're going to ask questions that no other provider has, because we've got to look deeper into the case history to find the triggers of what's really causing these speech delays. And second, that goes to the scans. Not only does our consultation and case history need to dive deeper, but so does our exam. So we're not just going to look at muscle function. We're actually going to look at nervous system dysfunction, dysregulation, and we can find that vagus nerve dysfunction on what are called our insight scans, our thermal, our EMG, and our HRV scans. Those are very visual. They kick out reports, they kick out scans, they kick out neurometrics. We can actually quantify the severity of nervous system dysfunction and subluxation, and most importantly, we can locate it. And with speech delays and today's conversation, that examination is going to focus very strongly on the upper cervical, the brainstem area, where the vagus nerve and the sensory integration and execution or expression nerves and muscles that are involved in speech reside. So we're really, really, really going to look extra deep at that part of the nervous system and the neurospinal system. And then number 3, they will sit down with you and give you a full report of findings that says, here's what we found, here's the care plan, here's your child's personalized, customized, individualized care plan to take care of this. Go take that next step, parents. If there's one thing I can leave you with every single episode, this information, I am going to try and kick out as much science, as much information, as much empowerment, as much explaining. I'm going to try and go nerdy and sciencey, but keep it simple and Iowa farmery at the same time. But the number one way I can help you is get you into an office of a nervous system focused pediatric and family chiropractor, because not only is that with the scans and the exam, and we can actually find this stuff and find out for sure if this is your child, but that's where you get the adjustments. That's where you get the care that can release this tension, restore this function. So when you get rid of subluxation, when you make these adjustments to clear that interference to the nervous system, guess what happens? Number 1 comes back online. Number 2 comes back online. Number 3 comes back online. So getting rid of subluxation goes back to that 3-step process and says, let's clear up the input. Let's improve the nervous system efficiency and processing. And guess what gets better after that? The execution and the formation. We see it all the time. Parents tell us, we've been doing speech therapy for so long, been getting some mild to moderate gains, or we're plateaued altogether. The moment, as soon as my child starts getting adjusted, now all of a sudden these results are coming out through this care. So it really is a combination of saying, let's address the root cause, subluxation, and then the therapy, and those things will take root and be so much more effective. We like to call that the 1 + 1 = 11 effect. But if you don't address that first one, subluxation, vagus nerve dysfunction, the second one is very limited in what it can do, because that root cause nervous system dysfunction, that needs to be addressed with nervous system focused chiropractic. All right, ladies and gentlemen, parents, providers, everybody out there, love this stuff, love going nerdy. We're going to continue our series on gross motor challenges, fine motor challenges, developmental challenges all together. As always, if you love this stuff and you're finding it's really helping you and your family, will you please make sure you subscribe? Please make sure you share. And if you take that extra couple of minutes to leave us a review as well, my goodness, that will mean the world to me. As always, we're here to deliver hope, answers, and drug-free help for your entire family. We'll see you on the next one.